Personal PT. Today we're going to go over shoulder pain and interventions that you can do to prevent it. Shoulder pain is a huge phenomenon in our society. If you think about it, we do so much that's in front of us. Whether we're running or biking or just driving or picking up our kids, we use so much of the front of our body and not as much of the back. So we get really tight in the front and we get stretched out in the back. And when that happens, we aren't able to move our shoulders as much, and oftentimes we start pinching those rotator cuff tendons. Everyone's heard about that rotator cuff tears, strains, impingement. We want to avoid that as much as possible. So we're going to go over a few really simple things that you can do at home, at the gym, in the car, that you can help prevent these injuries. And even though we're working on the shoulder right here, we actually need to strengthen the back area to stabilize the shoulder. Your shoulder is the most mobile joint in your body. And shoulder pain is second in prevalence only to low back pain. So it is a huge phenomenon that affects so many of us. So the things you can do for yourself are really simple. We're going to work in the shoulder blade area. So what you're going to do, first we're going to do shoulder blade squeezes, okay? So what you're going to do is you just squeeze those shoulder blades together and relax. And together and relax. And you'll notice from the side as I squeeze together, it's not a very big movement. And again, we're isolating certain muscles that are important. You also want to make sure that you're not like this when you're doing it. We want to strengthen in the right posture. Okay? So you can hold that 5-10 seconds. Do it throughout your day. Turn on those right muscles. The second thing you're going to do are shoulder depressions. Okay? So this one's a little bit harder to get, so give yourself permission to take a couple times. And you're going to push down and hold and relax. Some people need to go up just a little bit to push down. So if you need to do that, that's okay to get the motion. You'll feel it right underneath here. Those are your lats that are kicking in. And those really help with that shoulder mobility. Why? Well, the latissimus, it really helps pull the head of your humerus down. And if we're like this and we're rounded forward and that head isn't getting pushed down, you come up and you hit the top of this end bone. Go ahead and feel out to your collarbone, and then all the way at the end, you'll feel this kind of round end right at the edge of your shoulder. And that's where a lot of those rotator cuff tendons get pinched. So we need that latissimus to help pull that head down so you have room in your shoulder and you're not pinching on that bone right at the end. Okay? So push down and hold and relax. Super simple. Incorporate these into your activities when you're at the gym even. Do some shoulder rolls together and down and squeeze when you come together and down before you start doing arm exercises. So you're turning on those muscles you know to stabilize. You can even just do active range of motion as you hold that. I see a lot of people who have pain when they just move their arm. As soon as they do this, they're able to move it pain-free. Of course, it depends on how injured they are and what is injured, but try it at home, see how it helps. Again, maintain that posture. Thirdly, I'm just going to go over bands really quickly, a couple exercises that you can do because a lot of people have bands at home. So here we have a light green TheraBand. You always want to start a little bit lighter just to check how you're doing. You can bring your shoulders up to shoulder height and you're going to bring those arms apart, squeezing those shoulder blades together. Again, working on the back to strengthen the shoulder. And you can do a couple sets of 10, see how you feel. Make sure to do on both sides to even yourself out. And then another thing you can do is just range of motion with your bands. You can go ahead and bring those shoulders together and down and go forward. You can go out to the side. These are just a few ideas that you can try at home. Again, both sides. You can end up doing diagonals. But see a trained therapist or a professional if you need help diagnosing what is actually going on with your shoulder, as well as what exercises are appropriate for you. But I hope these exercises can help you prevent injury from coming on at all. Enjoy your life out there, stay active, and get you away from that computer position that we are all in so much. It'll help free up that upper thoracic spine as well as your neck. Thanks so much for joining me today. I'm Joanna. Here's Physical Therapy coming to you.